Did you know that this eye condition can actually steal the spotlight coming from your pupils or your pupil? Did you also know that there's a difference between this eye condition and this, even though their causes, symptoms, and treatment plan might be similar? So in this video, we are going to be looking at causes, symptoms, and treatment plan of these two eye conditions and how they can be prevented. Hi everyone, welcome to Seeing is Living, where you find educative information about your vision, sales of vision products like frames, sunglasses, protective lenses like blue cut and photochromic lenses, as well as sales of contact lenses. If you're just joining us for the first time, you're welcome. Take a seat, subscribe to the YouTube channel, and remember to give us a like and comment your thoughts at the end of this video. If you also have any topic you would like me to discuss in my next video, drop that in the comment section so that in my next video I'll take a look at that. Having said that, let's jump into this topic. So this particular eye condition is called pterygium or sufferer's eye, while this is called a pinguecula or yellow spots. Both of these are called degenerative condition of the conjunctiva. The conjunctiva is a tissue in your eyes that is located on the white part of your eyes called the sclera. Oftentimes, environmental factors like wind, dust, exposure to UV rays and light can trigger inflammatory or degenerative activities on the conjunctiva, which will lead to development of pinguecula or pterygium. Another causative agent of these two degenerative conditions of the conjunctiva is aging. Just like we know, as one is aging, the tissues, organs, and cells of the body ages as well, and the eyes or the conjunctiva is not exempted. The main reason why this degenerative condition of the eye surface is because of damage to the limbal stem cells. These are cells located on the cornea and around the conjunctiva. These cells act like soldiers that protect the conjunctiva and the cornea. Due to these environmental factors I mentioned earlier, especially excessive exposure to UV rays damages these stem cells that protect the conjunctiva and the limbus. This triggers degenerative reaction on the conjunctiva, which results in pterygium and pinguecula. Most pterygium usually start off as pinguecula, that's yellow spots on the eyes, and when this is not prevented, it can start growing or encroaching towards the black part of the eyes known as the cornea. And when this gets to the black part of the eye, it can alter the shape of the cornea, leading to astigmatism. If you have noticed, most people usually have their pterygium developing from the nasal part of the eye, although pterygium can also start developing from the temporal part. According to theory, the reason for this is because light usually enters the eyes through the temporal part of the eyes, and it will reflect on the nasal part of the eye, and this will cause damage to the stem cells of the conjunctiva and that of the cornea, which will lead to development of this pterygium or pinguecula. Another reason for this is that when light enters the eye through the temporal part of the eye, it settles on the nasal part of the eye, that is the part of the eye that is close to the nose, and this causes the proteins of the conjunctiva to settle on the nasal part of the eyes, and this will trigger inflammatory reaction, which will finally result in development of pterygium or pinguecula, and that is why it is called sufferer's eye, because the eye has been exposed to these harsh environmental factors. The period most people usually start to develop pterygium or pinguecula is around dry season, and this is because dry season is associated with dry and dusty air, as well as emission of harmful UV rays. And remember, like I said in the beginning of this video, these are the environmental factors that contribute in development of pterygium, because these environmental factors damages the limbal stem cells that protect the conjunctiva and the cornea. That is why this growth or disease is commonly seen amongst motorcyclists in Nigeria and other commercial road drivers because of the extreme exposure to UV rays, dust, and wind. This disease is commonly diagnosed amongst people living in harsh environments like those living in the north. The symptoms of pterygium and pinguecula are similar, like I said earlier. For pterygium is usually associated with itchiness, redness, and tearing, which can also be seen in a patient with pinguecula. Pterygium can lead to blurry vision, while pinguecula will not lead to blurry vision because it does not encroach to the black part of the eyes. The treatment option available for management of pinguecula and pterygium are similar, and they include prescription of protective lenses, and these protective lenses can come in the form of sunglasses, blue cut or photochromic lens, and the aim is to protect your eyes from these environmental factors that triggers the development of pterygium or inflammatory reaction in the conjunctiva. Another step your doctor might take in treating Pinguecula or Pterygium is to prescribe anti-allergies, which will help to calm the irritation, tearing, excessive itchiness that is usually experienced due to Pterygium or Pinguecula. Lastly is surgical procedures, and this is for pterygium, especially when pterygium has encroached to the black part of your eyes, trying to cover your pupil or your pupils, and then your doctor might recommend pterygium excision. As for Pinguecula, your doctor might not necessarily prepare you for surgery. This is because Pinguecula actually don't cause any harm or vision problem unless maybe for cosmetic purposes. Otherwise, Pingueculas do not require surgical procedures. So in order to protect your eyes from these UV rays or to retard the growth in your eyes, that is if you already have it, you need to put in more effort in protecting your eyes with sunglasses whenever you are stepping out from the house. And this is also what your doctors will tell you when you complain of the irritations associated with pterygium and Pinguecula.